Hello all, in this cover the respiratory anatomy for you. I'll mostly be using visible body so we can see things in 3D, and I'll have some labeling pages for you available on Blackboard, so you probably want to print those out so that you can label those diagrams that come from visible body, and of course use the practice activities that I post before you take the test so you can practice identifying these different parts of the respiratory system. And a few things I'm going to cover from diagrams from the textbook, things that I can't really clearly show you here on visible body. So respiratory anatomy is not too complicated, and there aren't all that many things you have to learn. And a lot of them you've already had before, hopefully in Biology 201, so some of it's just a review. All right, so here we have our dude here on visible body. We're going to start with the upper respiratory tract. And now what we're seeing here in brown here on visible body, what they have highlighted includes the nasal cavity up here. This is supposed to represent the oral cavity down in here, and you've got the different sections of the pharynx over here that we'll be taking a look at. And that brown tube that you see there is the esophagus, and anterior to it you have the larynx, and then we're seeing the first part of the trachea down there just below the larynx. Okay, so for the upper respiratory tract, we're going to focus on the nasal cavity first. Actually, let me get rid of this guy's skin. All right, so these brownish purple areas you're seeing there, those are supposed to represent compartments. And so like right in there, that is the nasal cavity, but imagine that there's a space on the inside of there. You know, if I hide that, it completely goes away. So we're not able to see a whole lot associated with it. All right, and bring it back. Oops, I didn't mean to do that. Okay, here we go. Let me hide this part of his face over here as well. Oh, that looks kind of cool. We left his hair in there. All right, so this is supposed to represent your nasal cavity. So it goes pretty far back in there, pretty deep. And of course, right in here, you have the openings to the nose, and the flared out part of your nostrils, those make up your nares. Okay, and they're not going to highlight those for you, but that's on your list. The nares are these areas of the nose where you have the opening, so that's where air is coming in, of course. All right, and then this space inside this region, which goes pretty far back in there, that's your nasal cavity. And the nasal conchae, you learned those because those are the superior and the middle and the inferior folds that you have on the lateral walls of the nasal cavity over on the left and the right side. And if you guys remember the superior and the middle, the reason you have those folds is because you have those rounded barrel-shaped features of the ethmoid bone that hang down on the left and the right side. And your inferior nasal conchae are actually separate bones that are parts of the lateral walls of the nasal cavity. And actually, let me flip over to a PowerPoint, because this diagram from your textbook shows this a little bit better for you than does visible body. So you have the inferior, the middle, and the superior nasal conchae. So bottom, middle, and top. So that's not too hard to remember. And that's those folded surfaces that help swirl air around in the nasal cavity as you're bringing it in, and that helps clean it. So the mucus in there helps trap some of the dust and particles, and also helps warm it while it's swirling around there before it heads down this way toward your lungs. All right, let me go back over here to visible body. Now, visible body does actually show the conchae kind of an odd way. Let's see. You know, that's supposed to be the inferior or the lower ones. And then those are your middle ones. I'm not sure why it highlighted that as well. And then the superior ones are these little bitty ones that are up there at the top, and they're way, way, way far in the back. You may remember that from taking biology 201 when you studied the skeletal system and you were seeing the bones that were responsible for that folding. They're really far deep in there and they're hard to see. Okay, and what about the nasal mucosa? Let me bring back my PowerPoint over here. So the lining of the nasal cavity, that inside lining, is called the nasal mucosa because that is a mucous membrane. It consists of epithelial tissue. The tissue type is pseudostratified ciliated columnar, and so that's lining that interior space in there. That's called the nasal mucosa. Mucosa is another name for mucous membrane. So we have mucous membranes lining these different features of the respiratory tract, both the upper and the lower respiratory tract. Oh, incidentally, your division between the upper respiratory tract and the lower respiratory tract, we're going to consider to be the larynx. That's where the dividing line will be. Everything from the larynx on downward, we're going to consider to be the lower respiratory tract. How about the nasal septum? So the nasal septum is simply the wall. It's not actually shown in this view on visible body. Let me bring up a skull and kind of rotate this around. But this bony wall, oops, well, that zoomed in a little bit farther up this guy's nose than I wanted to go. The bony wall in here that is formed from the perpendicular plate of the ethmoid bone, that's what I'm clicking on and off. And this is your vomer bone that I'm clicking on and off there. Those two things together make up this bony wall that divides the nasal cavity into two parts. That's called the nasal septum. That means nasal wall. Yeah, and while we're here on the skeletal system, you can see right there, let me deselect everything. There is your inferior nasal concha, which is actually a bone on the left. There it is over on the right, and then that's covered with the nasal mucosal membrane lining. There covers the bone inside the nasal cavity. And if we look up higher in this guy's nose, that's highlighting the entire ethmoid bone. You kind of see those folds hanging down there and over there. Those are your middle nasal conchae. Conchae is plural, concha is singular, and then the superior ones are higher up and much further back. We can't really see those. Okay, so I have this view back up. It comes in through the nasal cavity, and the next feature of the respiratory system is the pharynx. And the pharynx is actually, let me get rid of our skin here. The pharynx, let me get rid of the skin down here. The pharynx is divided up into three parts. So this upper part is called the nasal pharynx or the nasopharynx. That's what's highlighted there in blue. And then if you move on down below there, let me deselect all. This section is called the oropharynx or the oral pharynx. All right, so that is the portion of the pharynx that is behind the tongue, you know, at the back of the throat. When you swallow food and water, you feel that back there in the oropharynx. And if you keep moving on down lower, this lower portion of the pharynx is called the laryngopharynx or the laryngeal pharynx if you're looking on your study guide. So the whole thing is the pharynx, and the pharynx is divided up into those three parts. All right, the laryngopharynx, now that's shared between the respiratory and the digestive system, just as the oropharynx is up here, because obviously food and water pass through those areas just like air does. And so that laryngopharynx there is actually leading to the esophagus over here. We'll cover that when we study the digestive system in the next chapter. The esophagus is posterior to your trachea, right in there, which is covered with these cartilage rings that you see. And then if we go up higher, up in here, I'm going to, these are cartilages and other connective tissue coverings around the larynx. So this enlarged area that you see here is the larynx. So air is going to flow through the nasal cavity, through the nasopharynx, into the oropharynx, then the laryngopharynx, and then it's going to pass into the larynx. So let me hide, 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 and let me hide that. So once you remove those cartilages and connective tissue coverings, there's your larynx. Okay, so it is a respiratory compartment. It's just above the trachea, and that's where the air is going to first enter as it starts heading down here toward the lungs. So it's deep inside there underneath those protective. When you swallow food and water, the epiglottis closes, and that helps ensure that food and water in your laryngopharynx doesn't enter into the larynx. So the way it's positioned here, it's in an open state, so it needs to flap over and cover up the opening to the larynx. All right. If we hide that, let's see. Looks like they're not going to show us the vocal cords in this diagram. Let me pull up a PowerPoint and I will take a look at the glottis and the vocal cord. Okay, so this is actually a diagram from your textbook, and you imagine that the epiglottis that covers the opening to the larynx is up so that we can look down over the top of the larynx, and that's what you're taking a look at here. The glottis consists of this opening down into the larynx that you're seeing here, and it also contains these white structures that you see here. Those are called the true vocal cords, or your vocal folds. So you should know those terms. And those are tough fibers that are responsible for voice sounds, which that'll be covered over in the physiology lectures for the chapter. All right, and then out to the sides of your vocal cords, your true vocal cords, you have vestibular folds right here and right here that are shaded in pink on either side of the true vocal cords. Those are vestibular folds or false vocal cords. So you can learn either of those two terminologies for those. The glottis consists of the opening and the true vocal cords, so keep that in mind as well. Okay, I've brought visible body back up here again. So again, up in here, your larynx is that compartment that's deep to that these cartilages and connective tissue coverings that you see there. And then air moves through the larynx down here into the trachea, or your windpipe. Of course, that's something you had to learn in Biology 201, so that shouldn't be any kind of surprise. And on visible body here, all those rings that I'm highlighting there, those are called tracheocartilaginous rings. So the trachea, these features, these air passages, are protected by hyaline cartilage rings. And they're kind of important. We don't want them collapsing or getting crushed easily. They need to retain their shape. So the hyaline cartilage provides the consistency to achieve that. And visible body is kind of giving us a nice, more or less faded view of each of the lungs and the surrounding skeletal system. I think I'm going to strip the bones off here. Skeletal system, hide. Okay, so I got rid of the skeletal system there so we can see what's going on with the lungs. Isolate those and the respiratory passages. All right, so air passes through the trachea and then it's going to head over into a left bronchus, so you can see where that's located, or the right bronchus over here. And each of those that I just highlighted, that one and this one over here, is called a primary bronchus. So you just have one of those going into each of the lungs. But then, think about your respiratory air passages like a tree. Okay, so the trachea was kind of like the main trunk, and then that divided into a primary bronchus on each side, and then the primary bronchi in each lung divide into secondary bronchi, and each of those travels into a lobe of the lungs. So while we're thinking about that, let's go ahead and talk about the lungs. So So what I'm highlighting there, that is called the superior lobe of the left lung. So we can kind of look at that in 3D. That's something you can't really do with a diagram. And here's the inferior lobe of the left lung. Okay, so the left lung has a superior lobe and an inferior lobe, and you do have a little bit of a separation between those lobes. The right lung has 3 lobes, superior and middle and inferior. Okay, and you can kind of rotate that around and see where the borders are on these different lung lobes. So secondary bronchi extend into each of those lobes. So let me hide the right lung, and I'm going to click on and highlight in blue. Those are the secondary bronchi that are going to take air into particular lobes. Okay, and you have the same thing over here. Let me hide the left lung as well. So click on those. Those are your secondary bronchi that are going to head down into each individual lobe. So those are going to be the main branches that you see off of the primary bronchi. And then if we go, you think about a tree branching out even further and further. Highlighted in blue there, those are called the tertiary bronchi. Tertiary is 3rd level, so they're even smaller. Of course, we have them over here as well. And so those are carrying air. Those are pretty wide air passages that are carrying air into even more distinct locations within each lung. All right, and then finally, shaded in blue there, let me turn on multi-select. The other respiratory tubing and passageways that you see there are mostly bronchioles. Those are becoming smaller air passages. Some of them are called, visible body is referring to them as higher order branches, like higher order bronchi. So they're too small to be tertiary bronchi, but they're not small enough to be bronchioles. The bronchioles are going to be your smallest air passages before you start getting down into the microscopic type level of air passages and every little nook and cranny in each of these lungs. So that's what you're seeing there. All right, and let me move back over here to the PowerPoint. Okay, so this is a diagram from your textbook. So you have these bronchioles that are getting smaller and smaller as they enter into very specific locations in each lung. And those will lead to what are called terminal bronchioles. Those are very small bronchioles. Those branch into respiratory bronchioles. So those are going to be our smallest bronchioles. Those are leading to alveolar ducts, which this diagram actually is not showing us an alveolar duct, but there is a respiratory bronchiole is going to lead to a small air passage that then carries air to the alveoli. So these are the little tiniest air sacs that you see here, very thin walled. The importance of that thin wall is covered over in the on the physiology side. So you have alveolar ducts that you can't really see because they're buried. They're covered up by these alveoli down deep inside there. Okay, so air gets distributed into these little microscopic air sacs. Each of those, it looks like a grape cluster. Each grape is an alveolus, and each one of those is surrounded by a bed of capillaries. And those are your pulmonary capillaries that we talked so much about when we were going over the cardiovascular system, because that's where gas exchange is taking place between the air in the alveoli and these pulmonary capillaries that surround those alveoli. All right. And then the last thing we need to talk about, I almost forgot, we need to review the pleural cavities and the membranes that are associated with the pleural cavities. Okay, so from Biology 201, remember you have the thoracic cavity, this internal compartment. The inferior border is the diaphragm. All right, and you've got your left lung, you've got your right lung like you're seeing here on the diagram. And each lung sits within a pleural cavity. So you have a left pleural cavity, you have a right pleural cavity over here. The cavities are lined with serous, each one by a serous membrane called the parietal pleura. So that's a thin membrane that consists of a very thin layer of connective tissue and a very thin layer of epithelial tissue, and it produces pleural fluid, if you remember that from Biology 201. The visceral pleura is the serous membrane that is directly in contact with each lung. So this is the same deal like we had with the heart, where you had the visceral pericardium and the parietal pericardium. Just remember, visceral refers to viscera, that's organ. So that is the serous membrane that is always in contact with an organ. In the case of the lungs, that's called the visceral pleura. Parietal serous membranes actually are in contact with the walls of that compartment. And you have a very thin space in between the two. It's kind of like designated here and over here as well. That's your pleural cavity, and inside there you have pleural fluid. So if I ask you the name of the, what's located between those two serous membranes, you'll tell me that it's the pleural fluid. That's a pretty good little diagram here showing you the visceral pleura and the parietal pleura, and if you peel off that little window of the visceral pleura, you can see you're actually in contact with the lung underneath. Then also remember that the part of the thoracic cavity between the two lungs is called the mediastinum, and that's referring to medial, like in the middle part of the body, medial part of the body, close to the midline. And stinum is referring to the sternum, because all of these, the heart and all these blood vessels and the trachea, and where the trachea branches into the two primary bronchi, all of that is sitting behind and protected by the sternum. So stinum comes from sternum. So all of this is the mediastinum. Now, of course, the heart is sitting in the pericardial cavity, and then above there you have all of these important blood vessels that we learned about in the last unit, the trachea and your two bronchi, and then the esophagus behind there, and then even posterior to there you're going to have your vertebral column. All of those different things are parts of the mediastinum. All right, I think that's actually everything that we needed to cover for the respiratory anatomy. But before we quit, let's talk about airflow. Just like you trace a drop of blood when we were covering the respiratory system, I want you guys to be able to trace a parcel of air. I guess like a drop of air. You don't really have a drop, but a parcel of air. Or trace an oxygen gas molecule. Let's think about it that way. Trace an oxygen gas molecule all the way from the nares of the nose to an alveolus down deep in the lungs. What's everything it would have to pass through? So let's think about this. Right, so it's going to enter through the nares. All right, and we're going to be in the nasal cavity. And then what's it going to pass into? It's going to head into the pharynx, and it's pharynx, not pharynx. And but now we're learning the three different parts of the pharynx. So what's the first part? The nasopharynx. Then we go to the oropharynx. That leads to the laryngopharynx. And yes, if you want to, you can call those nasal pharynx, oral pharynx, and laryngeal pharynx. That's fine with me. Now we're going to pass through the glottis. Those true vocal cords have to part so the air can pass into the glottis. That leads into the larynx. But your Adam's apple, what you're feeling when you feel your Adam's apple, that's those cartilages that surround and protect the larynx. All right, now from the larynx, where are we going to head into? Either a left or a right primary bronchus. That's going to lead to a secondary bronchus. That 2 with a like a temperature symbol there stands for secondary. That leads to a tertiary bronchus. The 3 with the little degree symbol means tertiary. And we're going to say that those lead to bronchioles. And we're really thinking about larger bronchioles. Those lead to terminal bronchioles. The terminal bronchioles lead to respiratory bronchioles. Those are super tiny. Those lead to alveolar ducts. So in each case, you're branching into smaller and smaller structures. And then those lead to an alveolus. Alveolus is singular, alveoli is plural. And those are arranged in those cluster-like features. And then those are scattered all throughout the lobes of the lungs. And those, again, those are the sites where you have the gas exchange between the air and those alveoli and those pulmonary capillaries that surround them. Okay, so just as we've done with other anatomical features in this course, you will need to be able to identify and type out the names of these different features that we've gone over on the exam. I do want you to know the order of anatomical features that air passes through, or an oxygen gas molecule would pass through all the way from the nares down to an alveolus. That shouldn't be too hard to remember, especially since you've had a lot of these anatomical features previously. So know that as well, and do recognize things like alveoli and respiratory and terminal bronchioles and pulmonary capillaries on that blow-up diagram of the cluster of the alveoli that I was showing you on a previous PowerPoint slide. All right, and that's actually it for the respiratory anatomy. The bulk of the material for Chapter 22 will consist of the respiratory physiology. And check the study guides on Blackboard for more details about what you need to do to prepare for the Chapter 22 exam.